It's time for the Dr. Cho Show, the show that helps you understand the latest and safest modern dental techniques for you and your family. You'll become an educated dental consumer and also learn about health trends outside of the dental industry. Here's your host, Dr. Dan Cho.
Hello everybody, welcome to the Dr. Cho Show, your number one resource for everything related to our oral health. My name is Dr. Dan, and I am a general dentist here in Portland, Oregon. I have been also practicing in private practice for about 9 years. What is the process of actually getting implants? And, I'll mostly talk about, single implants, but dental implants is actually a relatively straightforward process. The actual surgery itself can take anywhere from 15 minutes up to a couple of hours, depending on the type of implant and treatment, whether or not there's any grafting, any type of complications or anything like that. But a vast majority of the actual work is done prior to surgery during the planning phases. Nowadays, a 3D scan of the jaw is taken using a cone beam computerized tomography (CBCT), which actually just gives the provider the ability to see the jaw in 3Ds. You can see a lot of the major structures such as nerves, blood vessels, sinuses. You can tell exactly how much bone, whereas before it was kind of sort of a guesstimate. I mean, it wasn't exactly a guesstimation, but degree of accuracy that it leads to incredibly accurate planning as well. And of course, more accurately that you plan something, the better outcomes that it's eventually going to have. So, you don't really have to worry about all the planning. That's really what the dentist is going to do. So really, what does it look like when you're getting the actual implant placed? So the process, obviously, that you're properly anesthetized, the site is made completely numb. You may choose to be sedated, and we can talk about sedation on another episode. But you may be sedated, you may not be, and everything is properly anesthetized. Now, I should also mention, if you don't really want to know all the details of what's happening, just stop, pause, and skip ahead. But I'm going to be kind of going a little bit into detail for those who do want to know actually what happens during the implants. And so, the first thing that's done is after depending on the actual surgeon, they may or may not actually place a gingival flap. I believe it's a good idea to do that because you can actually adequately see the actual bone, and so once you can actually kind of reflect the gum tissue back, you can actually see the bone. A pilot hold is made into the jaw that's ensuring proper depth and orientation in directions, multiple directions, because we obviously want to make sure that the implant is properly oriented. Subsequently, larger size drills are used to widen the osteotomy site. Then once the osteotomy site is an appropriate size, the implant is slowly torqued into place, and depending on the stability of the implant, either something called a healing abutment, healing cap, same thing, or a cover screw is actually placed in the torqued down. So if there's any additional grafting that's needed at the time of implant placement, it is done at this time. So if reflected to be able to see the bone, then they're kind of approximated, and sutures are placed in a tension-free manner to make sure that there's adequate blood flow. So that's really it. I mean, it sounds, it sounds very, very straightforward. But again, if we were to kind of really simplify things, you visualize the bone. You make a small hole, and you make subsequent larger holes, and then you torque down an implant. It's very, very, very straightforward. Now, it's a little bit different if a tooth is comes out and the implant goes in immediately, which can be done in a handful of situations. Sometimes it can, sometimes it can't. But for the most part, you're basically putting an implant in, and after the implant surgery, there has to be a period of healing, which is usually about 3 months. This is the time where there's a bone, a period of healing, which is usually about 3 months. This is the time where there's a bone turnover and the implant will actually integrate into the bone, and it fuses, becomes a part of you. You actually can't take it out without probably removing a little bit of the bone itself. And so once the osseoid integration has occurred, depending on whether or not if a healing abutment or healing cap, which is a little typically either a plastic or a metal little cylinder that sticks up above the gums. If that isn't there, then a process called second stage implant uncovering needs to be done, where it's a very, very minor procedure where the gums are anesthetized and the implant is actually found. You can either use a laser or a scalpel to actually go in to uncover the implant, find out where it is, and then replace the which you can't see is completely buried underneath the gums with a small little cylinder that kind of sticks out above the gums. This is mostly just to help recontour the gums and to allow for kind of additional kind of healing of the gum tissue. And so after that's done, then an impression is taken, and then sent to the lab to actually make the crown. Once the implant crown is made, it then is placed onto the implant via a screw, or it's actually cemented on there. And so there are a handful of important aspects to the crown that are checked, and then you're done. You basically get the entire, your tooth back. And so the process itself can take, anywhere from, about, let's say, 4-ish months, all the way up to as much as like a year. A lot of that kind of really has to do with how much grown in the area. I had previously alluded to, whether or not can you immediately put an implant. So let's just take a case for example. So we have Mr. Jones who comes in, and Mr. Jones has a tooth in the back, has a giant cavity, has abscessed, and now needs to have the tooth replaced. Worst case scenario for Mr. Jones is the surgeon goes in, removes the tooth, and does not believe that the implant can be placed immediately because whatever reason, let's say that there's too much pathology or this or that, and so the implant is then the implant is not put in. So the surgeon's like, hey, Mrs. Jones, sorry, we can't put the implant in. We're going to basically go in, cover it up, and we're going to have to wait a few months, wait for everything to heal, because common sense is that you don't want to implant put an implant in an area that has pathologic tissue. So you don't want to put it into an active infection site. This is what I actually really should have said. So what happens is after that initial surgery is done, Mr. Jones has to wait anywhere from about 3 to 5 months for the bone to kind of heal over. And then at that point, then they can go back and put the implant, which will be another 3 or so-ish months. And then after that's done, they can go back and, take the impression, and then have the crown made, which can take an additional few weeks. And so all in all, it can be a relatively short process of, about 4-ish months all the way up to a year. And so it will kind of really vary depending on the person to person, the different situations. So a few other really important things to kind of talk about is, what is it like after after you get an implant? And so the overall pain level, the general consensus for a lot of implants is that a tooth coming out is going to be generally more uncomfortable post-operative than an implant going in. I've had a lot of patients where with an uncomplicated single implant, may rank 0 to 2 on the pain scale, whereas I've unfortunately had some extractions not go perfectly well. And the post-operative pain from that can be anywhere from a 6 to 7 or something like that. Luckily, it's only for a few days, and a lot of these can be managed with short-term analgesics. And so in terms of how much time you need to take off after implant surgery, it will depend whether or not you actually had a tooth taken out at the time. Immediate implant treatment. Whether or not was it a more traumatic extraction, any types of a complicated health history, age. Any types of a complicated health history, age. Also, the type of surgery. Do you have a lot of implants being put in, or do you only have a couple? What is the level of sedation? Is there any grafting required? And also, what is the occupation's required level of physical exertion? I would expect that a construction worker who has to be really physically active would probably not be able to go back as quickly as opposed to somebody who has a desk job or is working from home. And so general rule of thumb is up to a few days, but I have had some patients with a very straightforward, uncomplicated. They have been able to go back the next day, and so speak with your dentist about that to kind of figure out, hey, how much time do you think that I'm going to need, and kind of plan a course. If you wanted to find out and get a free implant consultation here in the Portland area, this is how you can do that. Reach out to us, info@lifebloomdental.com. That's info at lifebloom dental.com. Or you can give us a call, 503-646-4600. Again, that's 503-646-4600. You can also go onto our website, portlandsdentist.com. That's Portlands with an S, dentist.com. And, just say, hey, I heard you about the podcast. I'd like to try to get a free, implant consultation. Be sure that you do mention the podcast so that we can make sure that it is free for you. So if you do have any questions, if you want to hear a little bit more about this, obviously come out and reach to it. And I hope that this was helpful. And, we'll find a lot of other topics to kind of really discuss in the future. So we'll chat soon. All right, have a good one.
Thank you for listening to The Dr. Cho Show. If you have any questions for Dr. Cho, you can reach him at www.portlandsdentist.com or by calling his office at 503-646-4600, or feel free to send him an email at info@lifebloomdental.com.